was listening to James Nestor was on a podcast, and he was talking about it was sleep apnea and then insomnia, but then insomnia and sleep apnea, and then how many is like a high percentage of how many people are treated medically for both of those. And it's either one, normally people with insomnia have sleep apnea, and then they're interchangeable, vice versa, or sleep apnea. So, you know, chicken and the egg, what is what, but don't we need to teach these people to breathe before we start medicating them? And it was kind of that, it made me think of the anxiety. Don't we need to, because, you know, if you went to the doctor right now, after what you've kind of experienced, they're going to give you something to treat.
I did though.
You did?
I was that freaked out about the whole, yeah.
You did?
I did.
Did they give you anything?
He mentioned it.
Okay.
Oh, well, because I wasn't sleeping. So,
yeah.
So he prescribed like a step up from, you know,
Xanax or?
No, it was like just a sleeping help.
Oh, sleeping aid. Okay.
Yeah, sleeping aid. Like something a little bit stronger than antihistamines.
Yeah.
It is basically an antihistamine, but it would be a prescription antihistamine. But no, I went because I was that freaked out about the whole situation.
Yeah.
And he did blood work anyway.
Yeah.
And the one good thing that came out of it was my blood work is good. And he's like, you're healthy. Like, I don't see anything physically, anything wrong with you. So because the pervasive, and that's what I keep calling it, a pervasive sense of unease, like something is drastically wrong. You know when your body feels right, and you know when your body feels wrong. That's why I always listen to people. Like when people say something's off, they know, because they know what right feels like.
Yeah.
Like, I don't know what your right feels like, and you don't know what my right feels like, but you know what it's like. So I have to listen to people who feel their own body. And I knew something was just off constantly. And it's a very unsettling experience when you can't, and I'm Mr., you know, I'm going to get to the bottom of this. I've been fixing myself for many, many years, and I've always gotten the answer. But like with this, again, I wasn't in control. And the only thing that could calm this brainstem down, or midbrain, or whichever part it is at that point, all of it, was proper sensory input and lack of, and not having something pressing in on my maxilla and my palate. And but who's going to know that? I had that feeling that that's what it was, and it was, but I still had to make sure. It's like, what if something really is wrong?
Right.
Well, I went.
And you're not too caught up, but you're so far down this that you can always fix yourself that you just totally missed the heart attack that you're having. I'm kidding.
Well, yeah. Well, I was having heart palpitations, the breathing, and sleeplessness, and it was the fact that putting something on my teeth could have, and then the ringing in the ears. That was the worst part. But of course, I was getting anxiety attacks, over the ringing in the ears.
Right.
So I was anxious and I was having anxiety, but it wasn't coming from the state of the world and the state of my life. Although, at the same time, it was because
it wasn't the night of the debate, was it?
No.
Okay.
No.
Because what you were saying and describing, I've never really experienced anxiety to be 100%. Maybe some underlying like tension with a big test. No, I did. When I had to teach in front of Ron Hureska, I did have anxiety. I take that totally back.
That was probably more like performance anxiety.
Exactly. So I've never had true, yes, this is different.
Yeah, this was when I was like on a flight one time from LA to New York, and I had been drinking the whole day prior and until like 3 a.m. because we were at a USC football game. The game was at noon, so we were on a party bus at like 9 a.m. And we were drinking, this was my 20s, and we were drinking the whole day. And then, you know, I had my flight was at noon the next day out of LAX back to New Jersey. And I woke up and I was still drunk. It was horrible. And I was visiting my brother's friend, and he needed to get a breakfast burrito first. So we were almost late to my flight. I got on, it was packed. It was packed. And I felt so horrible that I started to have like a panic attack. And I remember I just turned my head towards the window. Thankfully, I had the window there, and I just banged my head against the window very gently for 2 hours. Until
you gave yourself rhythmic oscillation?
Yes, that's what I did without even knowing. But that's what I did.
I'm surprised they didn't the flight attendant didn't call the pilot and they're like, we have a
It was
mentally
subtle.
unstable human being here on the
it was a very subtle rocking motion, but
Yeah.
just seeing the ground helped.
Yeah.
So I had window seat. So yeah, but finally it was a terrible experience. So that was the last time I ever experienced something like this, but it was, it was rough. And you can't stop focusing on the symptoms because they're with you constantly.
Right.
You can't think of something else. Like I did no work for 3 weeks. I wasn't responsive to anything. It was terrible. I think I probably texted you like, oh my God, my life's falling apart. but it was absolutely horrible. But that's like when people are in chronic pain or they have these types of POTS issues, like their system is running their life. And nothing they do intellectually can change that.
Okay, my other irony from these are just my realizations. 2020 vision is good vision. Okay, here's my irony on that.
Okay.
Because I spent about 7 hours with an optometrist in the past week. So we're actually going to get him trained up with Heidi. I think I told you this. Wise used to be with PRI Vision. So we're flying her down and we're going to integrate him in with her. And he's a behavioral optometrist. So he's already done wonders for a lot of my clients. But, I always check all my boxes when you're doing the medical assessment of somebody. And I always, do you wear anything on your eyes? No. I have 20/20. My vision's fine. Okay. What does that mean to you as someone who's literally been in an optometrist's office 2 times in the past year to get an update? What are your thoughts when someone says 20/20, my vision's fine? What do you think?
Nothing.
Like meaning, don't talk to me about my vision. I don't need to go to an optometrist. Yeah. My vision is fine.
I say, prove it to me. So first of all, I've been in 4 optometrist office in the past year.
My bad. I was under.
So if I make everyone prove their perfections to me. Mm-hmm. And I know if I put them in left stance, their eyes will betray them.
Yeah.
Because the greatest thing I have ever learned in PRI is to understand that left stance visual test.
Yep.
First of all, left stance, period. Because you can do so much with it. You can get people neutral with it. You can get them to understand the difference between the right side of their body and their left side, the comparisons you can make. But the moment someone says, I feel so stable on my left leg.
Yeah.
Okay, let's see. And then I'll have them move their eyes down to the right, to the left, up. And the astounding reactions that I will see. I've had people fall towards the camera and they couldn't stop it. So again, they realize I am not running the show right now. That was their brain trying to get them back to the right. Mm-hmm. I've had people get nauseous. I've had people, I remember one guy, he goes, oh wait. And he just had to open the window because he felt like he was completely flushed and nauseous and just felt like he was gonna get sick. So, if someone tells me they have 20/20 vision, or eyesight, I don't even know if you call it eyesight or vision, it means literally nothing to me.
Yeah, fair enough.
That's it. I mean, I don't care what you think you have.
Yeah. So it's just one of those things as a kid. I never wore contacts. I don't wear them now. I don't wear glasses. And I always, I thought, Pat, I'm like the healthiest of healthy can be.
Yeah.
Right? Carrots, I think carrots help vision growing up. And I'm rocking it because I don't have to wear glasses like you or whoever, and, as the more that I obviously go down this path, I start to realize that 20/20 is just the clarity of how well you see that sign. And it's this much percentage of what our visual system is actually for. Yeah. So after spending time with our optometrist who's behavioral, he said this cool fact the other day to one of my clients, because they're already getting it from me. And I think that I have some street credit, but when you're actually in the office and someone's looking at your eyes and telling you all of these things, but he said, 94% of what you use is, he said 6% is actually used for your clarity, for your eyeball. 94%. and I've heard 70-30 too.
Yeah.
But he just quoted that. But 94% is actually what's used for your depth perception, your spatial awareness, where you actually are in space. Did my foot just hit the ground or did it not? And it's, it's just one of those things that it's just ironic, I guess, because we got all caught up in this. I got 2020. I'm good. You know what? Actually, I have 2015. Don't take it away because I like to hunt on the weekends. I don't know, I'm Texas, so I gotta relate it to that. But yeah, it's just funny. 2020 means nothing, like nothing. And there's this other phenomenon called monovision.
Yeah.
I had 3 patients this week. 3. 2 I saw with him. I had to take him to him because our program wouldn't work. And so monovision is where one eye is corrected to see far. So your depth perception, you can see really far. And then the other eye is corrected to see up close. So imagine you're trying to train someone on their left leg and you're wanting them to process the world and you're wanting to look a little bit further out because they got to trust that left leg when they walk. But yet their eye is really trying to read a magazine in front of you.
Yeah.
Hey, good luck with life. We'll see you later. And it is insane how many people now I'm starting to they just happen to pop up on my schedule that are monovision. I don't know what the percentage is, but
like is it because you're looking for it or is it something?
So no, I always ask.
Okay.
But what typically what I'll find is after I have them do some sort of technique to get their neck loose. So you remember our pattern, right? When we're a left cranial side bend. So we're over on our right side, our necks are here. Now we don't necessarily look like this. Some people do, actually. A lot of people do. But so as that neck's staying there, if it's a dental problem, I'll put them on the table, maybe change their bite, do a few techniques, stand them back up, maybe keep their bite the same, right? Lay them back down, and then their neck got tight again. So I'm like, all right, visual field. So that's how not that I've been finding it. And then when I ask someone, they're like, oh yeah, I'm corrected in monovision. They don't really think to tell you that.
They don't.
It's not like I had my ACL torn and repaired. It's like they just don't. That's just not a thing.
Yeah.
It's that doesn't matter. And it's like, oh my gosh, it matters so much because these 2 patients, they happen to be in their 50s and 60s specifically, are literally can't, and they're very happy, pleasant ladies. They hurt almost every single day. And they've been seeing practitioner after practitioner and working out with their personal trainers. And it was just like, nothing felt good. Right. That's your first sign right there, right? Yeah. But that system, so what we have to do is correct that eye. One was actually had implants in for monovision. So not just contacts, has an actual lens implanted in her eye when they did cataract surgery.
Oh, wow.
So it's a lot. But I just am, you kind of throughout your career go through your little, I don't know, sometimes things pique your interest more or they just become more relevant in your life. You see a lot of salsa dancers. I don't know, or maybe you did.
They never believe me on anything.
Yeah.
They're just going to keep stretching. I'm like, you can stretch all day long. That's not going to change.
Yeah. Come see me when you're ready to change.
Yeah.
But I just have had a lot more, and maybe that I'm just now to the point in my career where I can just see it faster. Yeah. But maybe they were vision, 5 years ago, and I wasn't. Yeah. I didn't have the team either. I didn't have a team or the knowledge base of telling them what to tell their optometrist. But
that's still my difficulty. I mean, like even with my questionnaire, when I'm, again, still doing more online stuff than anything else, I have half of my questionnaire is dedicated to the head.
Yeah, as it should be.
Tongue issues, dental issues, and visual issues.
Yep.
And of course, people that get the questionnaire are like, why is he asking about this? Well, that's exactly why. Because I know from my own experience, if you have a true visual issue, which I don't think most people have a true visual issue, that's going to prevent them from feeling better and getting neutral and stabilizing. Most people do not, and I always try to stress that.
Yeah.
But if you do have one, and it's truly there, nothing we do is going to work. Yeah. I've been through it.
Yeah.
I can tell you without a doubt you will feel nothing correctly. You'll feel your neck, your back, your hip flexors, and your shins. You will feel nothing correctly. I can give you all the perfect references. Right arch, left heel, left posterior rib cage, everything. You will not feel any, first of all, you won't even get into the right position. And you will feel nothing correctly and nothing will work. And that's hard because you cannot overcome it. It will override everything you try to do. Even if you have a good day, the next day you're going to feel like crap. And like, it's going to be up and down, up and down. Yeah. Like some days you'll feel things, other days you won't. And it's like, it's always hit or miss. And I just know vision can do that to people. But who do I have backing me up on that?
Right.
I've had two people recently. One guy was from South Carolina, another gentleman from California. And the guy from California, he just emailed me. And he finally saw someone. I started working with him last year, even before COVID. And I suspected from the get-go that his vision was involved. And I can't remember exactly why. I think it was because he wasn't sensing things probably. See, when you know how to do this for long enough, when you've done this for long enough, you know exactly what everyone should feel with every technique that you're giving them, because there's not a million muscles that we're feeling here. There's like 5 muscles that you're really going to feel for the most part. Scapular muscles are hard to feel, but that takes time. But in the legs, you're going to say, you still want them to feel the same muscles over and over again. If they're not feeling it, they're not turning off a pattern. It's not work harder to feel the muscles. It's what are they not turning off, which is obviously the right side. But when they can't feel anything ever, in any position, and all they feel is their back and their neck, that's when I go to that left stance test. And it doesn't lie.
Yep.
It really doesn't. But people don't, they're like, well, this doesn't make sense. So, but then he emails me a year later. He went to see someone in California who knows a little bit about this. And lo and behold, when he manipulated his visual system, he went 90% neutral. And that's what happens. And that visual integration course, as they talk about one muscle, the anterior glute medius. That's the only muscle they talk about. But when I understood that this is all sensory and it will override anything you try to do in a muscular way, that's when I had my big aha moment, was that visual course, because I realized that everything that we're doing indicates a system that is integrated or not. And the vision and teeth will override everything you try to do. So they take that highest priority. And another guy, he was from South Carolina. Again, I worked with him like last year, left stance test, fell towards the camera. And he told me, he got in touch with me a year later. He's like, you know what? I didn't really believe you, but I think I do now. He was wearing progressives, couldn't get used to these progressive lenses. He's like, I felt like crap for a year with these progressives. They just kept saying, no, you'll get used to them. He actually tested better in left stance, and it wasn't good left stance no matter what, but he was completely unstable either way. But he tested better without the progressives even on. So without correction, he was actually more stable than he was with the progressives on. So I told him he's going to have to see someone live, and I think he's traveling to North Carolina probably to see someone in North Carolina who can obviously help with that.
Right.
But vision will wreck your life, as it wrecked mine.
Yes. Yeah. Some of my tall tale signs when I work with visual driven, where I know it's a part of the picture. How about that? I don't know that it's 100% the picture.
Right.
But you cue it up so good. I'm manually there putting their hips here, just to help out if they can't get it with verbal. I'm even demoing and they still can't get it. They can't, almost they're we call them, like some people call it like a motor moron, but they're not, but they don't know where their body is in space. Or I was doing a technique with he actually plays for he's a professional baseball player. He's a major leaguer, and he had his feet on the wall, and he had to keep looking up almost to see where his feet were. Every time I had him doing alternating, I would see him, and I didn't say anything. I just watched him kind of look up and, move his feet. And you start to pick up on these little tendencies because they don't trust this to place their body in space. Yeah. So there's a constant having to check, or a constant I have no idea what's going on underneath here. Yeah. So vision is it's fascinating to me, and I'm really looking forward to us getting our thing going in Texas here, where we kind of crank out this program where we got dental and optometrists, because I think people, you just kind of have to have it at some point when you've gone down. I mean, it's beautiful when all you have to do is blow up a balloon and do a 90-90 and then a reach. It's awesome. It's just not real life with the way our world is going and people sitting like this all day long. Myopia 101 is everywhere. Nearsightedness is what myopia is. And
I understand, and it's so frustrating. I have no one to really work with.
Yeah.
And it's for lack of a better word, it sucks.
Yeah.
I know.
You feel limited.
I feel very limited, and because I can't tell them. I am good at knowing when something's not right.
Yeah. Yes.
I'm pretty good at saying that. You have to know what normal is, and then you know what abnormal is.
Totally.
I mean, abnormal in the sense that I see it all the time.
Yeah. I
see this abnormal quite often. It's just not what should happen if you're a normal human being with a body that can alternate and a visual system that can alternate on both sides and a jaw that can alternate on both sides. Mm-hmm. You know what normal is, so you know what abnormal is, and you can tell them, look, I don't know exactly what's going on, but I know this is
not right.
It's not normal, right?
Yeah.
And once you've done this long enough, you realize there's not that many influences that can cause that, as long as they're not sick, as long as they don't have some sort of disease that we're unaware of, idiopathic pain, there's really not that many influences. And what the top two are going to be that are going to hold people in patterns. It's going to be eyes and teeth every time. Yep. Feet you can work with. You can make homemade orthotics. I have so many people like, I do that right arch thing with the paper towel, and wow, I feel my body shift to the left. You can work with that. I'm not saying that's your long-term solution.
Neil, are you a podiatrist? Am I hearing that you're a podiatrist with your Downy paper towel rolls?
Yeah, but you can work with feet, and you can show them like, oh, see how much easier it is. Look at this range of motion on this abduction lift test, and they can see that and they can experience it. But with eyes and teeth, they're like, I don't know what the hell to do. And you have no one to send them to that would know what I'm talking about anyway.
Because it's not, even if they understood visual space and understood peripheral and opening peripheral, and there's certain axis that they can open up more through a lens, you still have to understand that we're in a pattern.
Yeah.
And that's I have this picture here. Let me see if you can see it.
Oh, nice.
So it's of the brain.
Us.
Here. Yeah. And then peripheral vision.
I thought it was cauliflower.
Oh, shut up. But do you see how they got two lines coming there and then one coming out? Yeah. So that's your this side is your left peripheral. Make sure I'm saying that right.
How do you say it? Peripheral or peripheral?
Oh, I'll probably put my Texas slang on it. But
you don't pronounce R's in Texas?
Peripheral.
There you go.
So there's your left peripheral.
Yes.
I had trouble with the word anonymous. And do you see that your right brain here is helping the left eye, so it's also helping the right eye, and only the left is helping the right. So you've got two inputs into that right eye versus one in your left. I mean, that's in a behavioral, that is taken from peripheral visual field loss and visual neglect diagnosis and treatment, Journal of Behavioral Optometry. That's in a journal. That's not PRI.
That's what I said. Like, this is it is PRI because we're aware of it, and it's really freaking important.
Right.
But that's why I tell people, like, PRI is not making this up.
Right.
It's the research. Like, Ron didn't invent anything. He just, like he said, he's like, I didn't invent anything. I just read the research
and put it all together.
Yeah. I mean, how can someone not look at that and say, huh, now as an optometrist, I know that we preferentially process right peripheral vision.
Right.
And I know that vision is not just to see, we have to see to move forward through space accurately without getting hurt.
Yeah.
Huh. Never, that's as far as it went?
Hey, in defense of all of that,
yeah.
Remember back to my PT school?
Yeah.
I'm looking at a huge muscle called the diaphragm and clearly seeing that it's not the same from left to right, but no, never hit me in the face.
Yeah.
with in response to movement of the spine and the orientation of the spine.
Yeah. Or
so yeah, I mean, do you know what I mean? It seems like
but
that should be,
but on the other hand, I mean, they're well aware that
yeah,
gait and vision, or forward movement, or for whatever they want to call it now, you
yeah,
know, forward movement and vision are one and the same. I mean, because there's no divide. You use your eyes on there's no such thing as a vision exercise.
yes, right. Everything's
Everything's a vision exercise, because everything, yeah, you use your eyes for everything except if you're blind. So, but it's just interesting that no one ever thought about, you know, and it's not that they don't know that left peripheral vision will make your body sway to the left. They know that also. They know
right,
that making contact with your left teeth will move you to the left. That's why it's a test.
right,
A test. Do you see their mass move to the right or to the left when they make molar contact?
right.
I looked up all that research that they reference. It's all there. But it's interesting. Like I read one thing over a year ago, and I don't know if this was referenced in the PRI manual or not, but they had infants just sitting, and they would move the walls. So the infant has no clue what's going on, obviously.
Right, right.
All they knew was, the infant didn't know, but what they saw was if the wall moved on one side, the baby rocked to that side.
Uh-huh. Uh-huh.
So that's kind of interesting. And now we have double the processing, maybe not double the processing power, but more processing power to the right side.
Mm-hmm.
No one ever was like, hey, how is that going to influence our movement?
You know, that was always what you just said, the example is always why I think that they should set up treadmills, which are terrible for you anyway, in my opinion. But in a gym, opposite. So you're having to run by somebody. So you run faster, you know?
I think treadmills are horrendous.
Yes.
Because, so, like, you're not pushing forward, you're just trying not to fall down.
Correct.
So that's issue number one.
Yes.
Number two, there is no optic flow. The world is not moving past you, which your brain expects if your legs are moving forward.
Unless you have someone running on a treadmill the opposite way next to you.
Yeah.
I don't know. That's what I'm
continuous
saying.
loop.
Yeah. Anyway.
Yeah. So you don't have optic flow. What else? Most people are watching a TV.
Fixed optical
bearing, which is not good, which makes your visual field narrow and extension. And then there was one, and now they have like walking desks. So now you can type as you're walking, and you are purposely restricting your ability for your torso to rotate, and you are literally walking yourself into a pattern.
Yep.
Treadmills are terrible.
But it's healthy. Remember this whole part of being healthy? It's healthy. We're strong. It's healthy. Yeah. I know. I always encourage patients that, you know, I'm like, I get it. If the weather's just absolutely terrible, you're just gonna have to get up early because it's hot here during the summer. Please just walk outside. And while you're doing it, swing your arms.